What could be more encouraging in a COVID hotspot like Toronto than better weather and a loosening of restrictions for activities like outdoor dining? But don't be misled. Nearby, inside some Toronto and area hospitals, a much more discouraging scene. Hospital beds and intensive care units are filling up again. Ontario's Science Advisory Panel suggests COVID variants now account for 67% of all COVID cases in the province. And they seem to be hitting younger people. The percentage of patients under age 60 in ICU beds has risen 50% since December.
So they're younger. They're younger and they're sicker.
This emergency room doctor says it's as bad as it was in January.
Yesterday, I had an emergency shift, and it really felt like I felt at the peak of wave 2.
Here are the COVID curves for Ontario since December for infections, for hospitalizations, and for ICU cases. The second wave happened in January, but now you can clearly see a third wave has begun in March. Note, there was a provincial lockdown just after Christmas. As of March 28th, there were just as many infections as there were on December 26th. And for ICU cases and for hospitalizations, the numbers are even higher now than they were then. And these numbers will continue to rise. Ontario is preparing 2 field hospitals, this one in Toronto and another in Hamilton, to increase hospital capacity. But as demand for ICU beds is sure to increase, so are demands for another lockdown.
Right now, what we're seeing in the GTA, they need to put on the emergency brake and they need to close schools.
Closing schools would be a very big change of course for Ontario. Premier Doug Ford says he's prepared to act, but for now is only warning against travel and gatherings over the Easter weekend.
I'm asking you, don't make plans for Easter. That's what I can tell you. I won't hesitate to lock things down if we have to. I did it before, I'll do it again.
Another hopeful sign, vaccinations. But it's clear they won't protect us soon enough to avert what's happening now.
It's not going to stop the third wave. It may blunt the impact of the third wave and maybe shorten its duration somewhat. But we're going to have some suffering in the next few weeks or months.
A tough time ahead for Ontario, and it's not the only province.
I'm Robin Gill in Whistler, BC. The resort has been shut down because those variants are taking hold in this community. It's a major setback, and it feels very much like March 2020 all over again. This is what skiers look forward to, a bluebird day. But the lifts aren't moving. The passes now a waste.
We thought it's safe. The best place to be is outside.
These spring breakers can't catch a break. The ski hill was closed last year at the same time.
This is what happened last year too with these kids. It was like as soon as their spring break started was the same day that the mountain closed down last year.
The province has shut Whistler Blackcomb, and workers don't know what's happening next.
It's an abrupt end to the season for sure, which, yeah. No one saw it coming.
This is the height of the spring ski season, and it's a big economic bite. Is that taking a sledgehammer to your business?
This year has dramatically impacted us. We're a tourism community, and that's what keeps this place going. And in a COVID world, there is no real economy in our community, which is why it's so important to get to the other side of this.
The province's public health officer is clamping down because cases are high in this part of British Columbia.
We're starting to see cases increase again in that community, and particularly in the past week with the more worrisome cluster of the P1 Brazil variant of concern.
We have the variants in circulation, particularly the UK variant, the Brazilian variant, and these are significantly more transmissible, probably twice as contagious.
The message has always been get outside. It was the safest bet, but it's what happened in the après that is taking away the fun.
Skiing is what kept me sane through the whole pandemic, just to get outdoors and have some outdoor fun.
It's a 3-week pause here, and it's taking a big chunk out of the spring ski season, much like it did last year. A spokesperson for the resort says it was caught by surprise, but it will comply with health orders. Donna?
All right, Robin Gill in Whistler, BC, thanks. Quebec is also seeing a steady rise in cases. The Premier warns tighter restrictions may be needed there, too. The highest case counts are in 5 regions outside Montreal. Premier François Legault says the biggest concern is social gatherings. Police have been ordered to crack down on rule breakers over the Easter weekend. The Quebec government is also considering moving the 9:30 p.m. curfew back to 8 p.m.